But today we are very fortunate to have Eve-Lynn Nelson as our presenter. Dr. Nelson is the Kansas Telebehavioral Health Network Project Director and Professor of Pediatrics and Telemedicine at the University of Kansas Medical Center. She is a Fellow of the American Telemedicine Association College of Fellows and serves on the National Quality Forum to identify existing and potential telehealth metrics to guide principles for future telehealth measurement. She helped develop ATA's Child and Adolescent Telemental Health Practice Guidelines, and at KU Med, she is the PI for Telehealth Rocks, Telehealth Rocks Schools, and the Heartland Telehealth Resource Center grant, all from HRSA. So I will turn the program over to Dr. Nelson.
So I just want to start out with a thank you. The slides that we're going to go through today are really a team effort, and I especially want to extend admiration and appreciation to folks. I know that there's friends on the line participating today, and also to thank our telehealth participating families and their communities, our partner sites, our team, and also our funders. Today I have two objectives. I want to give an update on telebehavioral health best practices, focusing some on the telebehavioral health national guidelines. And then there's so many examples in Kansas, so I'm going to talk about some examples that I've been involved. I know there's many other examples. This is just to get our minds thinking about the smorgasbord of different telebehavioral health opportunities. Some on the research side, and then in this exciting time with telebehavioral health, many of the services then going from research to best practice and extending to care, just part of clinical care. I think with telebehavioral health, it really is an exciting time. Just as we were on the webinar today, the technology offers the potential for connecting any place, anytime with anyone. And then with telebehavioral health, being able to connect really across the country or across the world. I think with that great potential, as always, there comes great thought that needs to put in to make sure we're delivering the best possible care. And as we're looking at where is telebehavioral health the best fit, what's the best technology, what's the best practices, really trying to work together from the distant site and the hub site, and really looking toward national guidance about how we make sure we're delivering the same quality of care utilizing the technology. When I talk about telebehavioral health today, I'm really focused on the live video conferencing component. The telehealth umbrella, of course, is a larger umbrella that speaks to all of these different types of uses of technology for health purposes. But I'm really going to be focused in on the synchronous live two-way video conferencing component. The others are really important areas of care, and they're also ones that are growing and with growing uses for telebehavioral health. But live video conferencing is the one that we currently have the best reimbursement, and then it's also the one that I'm most utilized. So that will be the focus today. I think with that, just a reminder that really thinking about the technology as a mode of delivery and how it helps us translate our best behavioral health services over the technology. It's not a whole separate or different service. It's more that idea that it helps extend our best services. So why is telebehavioral health taking off now? Partly it's because of strong consumer demand. Some of that's driven by the direct-to-consumer models, where it's using the technology to reach the patient and family right in the home. But there's also just a greater consumer familiarity with the technology. They've used Skype, they've connected with their family across states. So they're used to the same type of technology. Of course, with telebehavioral health, we're using more secure technology, but there's just a growing consumer demand about having telebehavioral health options as part of general care. There's also health reform is driving telebehavioral health. Some of that has been driven by the opioid crisis and the overwhelming need to be able to extend our best treatment services. Some has been driven by overall information technology advancing. I know for many of us, it's still got a ways to go, but we're seeing advances on the information technology side, especially as we're looking at telebehavioral health and the electronic medical record and how those two things intersect. The patient-centered medical home has helped advance telebehavioral health, especially with integrated care models. The shift to value is also driving telebehavioral health. And I'll talk in a little bit about a new project led by Dr. Mosier and the Kansas Clinical Improvement Collaborative. And it is looking at telebehavioral health within the affordable care organization environment. There's also now reliable, secure, low-cost technology. There's been a lot of investment in telebehavioral health, especially with the baby boomers and increasing behavioral health needs with the elder population. And then just as Janine opened this session, there's a growing number of federal and regional resources to promote telehealth, to help make sure we're doing all the best implementation side of things to develop sustainable telebehavioral health services. So the promise of telebehavioral health really overlaps the promise of healthcare in general. The goals with telebehavioral health are to improve the patient experience. So really there's the hope that it decreases stigma and really helps with the patient experience. We're looking at better health outcomes, and we're really living in a fortunate time for behavioral health in general. We do have good treatments for a range of adult and youth conditions, for depression, for anxiety. We're fortunate to have those interventions, and the technology opens doors for us to be able to spread the reach of the evidence-based interventions that we're fortunate to have. There's of course growth we continue to need up and coming interventions, but the technology helps us extend the best care that we have. There's the idea that telehealth can improve care team experience. So really part of that whole quadruple aim, decreasing provider isolation, offering opportunities for care coordination. That's really the hope that with telebehavioral health services, that piece is also kept front and center. And then of course the goals to lower healthcare costs. And overall there is good evidence that telemedicine can help with lowering healthcare costs. There's a lot of nuances with that, really looking at the particular service, but especially if you're looking at some of the costs the patient experiences, there's a promise to lower some of the costs. Put in another way, this is again the kind of the rationale for telebehavioral health, to increase accessibility, to increase availability, and to increase acceptability with behavioral health services, particularly to decrease stigma. I think this is a picture from our telehospice team. So really speaking to some of the accessibility issues. With that project, it's looking at home-based services. So the hospice nurse is able to see patients more often, even when there's weather or other transportation challenges, and being able to work with the telehospice patient. So it's really bridging that gap and augmenting the excellent on-site services. This is to give you an idea of some of the needs in telebehavioral health. So really looking at gaps across the country. So I know this is a little bit small, so the green is the very limited access to behavioral health professionals. So you'll see, especially in rural areas, real gaps to being able to access care. So the idea with telehealth continues to be to take expertise and be able to extend it across the state. And of course, with our state really looking at 2 time zones and a broad geographic area to serve. This, it just repeats some of what we've been discussing. This is a reminder that really telebehavioral health's at a tipping point, because we're hearing from our communities with their community health assessments that behavioral health is really a priority, and it's something that there's real challenges to meeting that need. So looking at ways that we can partner with the behavioral health, be it at the academic health center or with other behavioral health providers, in order to work with the community to meet that need.
Hi, Eve-Lynn. Is there any way that you could go down to the slideshow icon and so that we can see the entire slide? We're seeing some of them cut off. There we go. Thank you.
Thanks for the reminder, Janine. I appreciate it. So just getting back to kind of the what I wanted to emphasize today with the telebehavioral health best practices, it's also sharing that there is a growing evidence base for telebehavioral health. This references a broad review article by Bashir and his team. So again, just there is growing evidence that of telebehavioral health as an effective treatment across the range of demographics, so across youth and adults and diagnostic categories. And as they note, there's positive trends in showing cost savings with telebehavioral health. There's also information from the more recent National Quality Forum literature review that really builds upon the Bashir review. And then in my own world of child telebehavioral health, there's not as much evidence, but there's a growing evidence base, including randomized trials, suggesting that telebehavioral health is effective. And then we also look at a downward extension, really drawing some of the lessons from the adult telebehavioral health. I don't want to spend a lot of time on this slide. I just, it's more one to provide a resource as you're looking at telebehavioral health, and if you're looking at some of the research and evaluation, the National Quality Forum developed a measurement network. And the idea with this is to make sure we're utilizing the evidence-informed metrics, so that then as we look across telehealth projects, it gives us greater information in these key domains: access to care, financial impact, experience, and effectiveness. So this is a whole nother webinar that we could speak to more. I just want to have the resource in there, so as folks think about it in their own areas, to think about which evaluation areas that they may be most interested. With telemedicine models, again, I'm more speaking to supervised models today. So that means that there's a local presenter or champion at the telehealth site, and the patient is coming to a supervised setting, be it primary care, a clinic, a school, and other settings. A growing area of work is with home-based settings or unsupervised settings. So that would be when the patient didn't have the presenter with them. They were directly connecting for services. There's growing interest in the research world around home-based and unsupervised settings, and some states are moving toward reimbursement for those models. And then, of course, the direct-to-consumer is utilizing those models. With telebehavioral health, we do sometimes see a mix of utilizing telemedicine and televideo, as well as on-site visits. there's the Ryan Height legislation, which if you're prescribing a controlled substance, there's requirements around seeing the patient in person. There is legislative updates related to Ryan Haight, so that landscape may be updated. The Ryan Haight legislation included a telemedicine registration that was as to be implemented. So there's discussion about how that telemedicine registration may look, especially with the opioid crisis. There's been particular interest in looking at updates with Ryan Haight. So that more to come on that, I'm sure, this year. And then there's also indirect models. So the telementoring or Project Echo models, e-consultation. With these, it's more the idea of provider-to-provider consultations and using the technology for the specialist to be able to collaborate with primary care. I think with all these models, what we really try to keep in mind is that balance of access and really meeting the needs that we talked about, and then quality, really keeping the patient safety in the middle. And as you're thinking and weighing pros and cons of different models, that's really what we try to think through is how can we continue to ensure the best quality and the patient safety. Janine, I know, can speak to some of the nuts and bolts as we look at rolling out telebehavioral health. These are the same kinds of things that we really keep in mind across telemedicine rollout, but really thinking through as you're beginning and then continuing telehealth programs, these key components. And it's an exciting time. The landscape with some of these are changing. Reimbursement, there's exciting extensions with some of the telehealth reimbursement in our own state with some of the legislation and some of those, although some of that is in a holding pattern, but really continuing to assess these key components as you're implementing the telebehavioral health project. Folks are also looking to their professional guidelines around implementing telebehavioral health. I'm going to give examples from the American Telemedicine Association child guidelines. I was involved in developing those, but many of those key ideas translate to these other professional guidelines. The one that's most hot off the presses, released in 2018, is the American Psychiatric Association American Telemedicine Guidelines, and especially as you're working with adults, those are it's also an excellent resource as you're thinking about that guidance in implementing telebehavioral health. So I want to go through again. This is to give an idea of the kinds of things that the guidelines help us think through with telebehavioral health. Starting out with administrative guidelines, thinking through standard operating procedures and what protocols are needed in order to deliver best care. So I think many of this overlaps good behavioral health care in general. So things like determining coverage and understanding the family's coverage specific to behavioral health and specific to the telemedicine component. Thinking through on the organizational level, making sure that the staff supporting the telemedicine encounter and our providers have the training and support needed to meet the youth, family, and providers' needs. And then thinking through the providers' competencies across evaluating and treating the patient population. In addition to administrative guidelines, we of course always recommend thinking through the legal and regulatory issues. And again, this is a moving target, so interacting with your telehealth resource center, talking with your state board is really important. as you're moving forward with telebehavioral health. Specific to child behavioral health, we of course do think through things like legal guardianship of the youth, thinking through completion of the informed consent. Really, we try to approximate much of the same informed consent to treatment as you would see in our general behavioral health clinics with some telehealth specific language. Thinking through the presenter and how they may help complete any medication consent requirements, and then thinking through all the confidentiality requirements related to the clinical setting and HIPAA, and then really dependent on the site that you're connecting. So in the school setting, thinking also through HIPAA and the privacy rules associated with that. One thing with thinking through HIPAA, of course, we're always thinking about the technology and that security. I know with our Telehealth Resource Center, we really also work with sites to think through the environment in HIPAA, where the equipment is placed, how folks who may be new to the behavioral health setting are supported to make sure that it's the technology, but also the whole environment is thinking about the confidentiality of the telebehavioral health patient and family. In terms of the physical location and telemedicine space, just thinking through ahead of time, how can that space be most patient friendly? With kids, thinking through, are there any need for toys or other things that may help the provider on the other end as they're assessing and treating the child. Thinking through the lighting, and then thinking through if this space is large enough to accommodate all participants on the screen. This is one that's especially true in our school-based settings, where we're really fortunate in those school-based interactions to have a whole team from the school who may be helping in the assessment and treatment of the student, having, of course, the parent and guardian and the student, and then being able to manage it and make sure that we're taking in that full picture and making sure the space allows being able to work with that full set of folks who are coming to the telebehavioral health encounter to help support the student. As I said, much of our work has been done in supervised setting, where there's a telemedicine presenter. That may be a school nurse, it may be a clinic healthcare professional. Really, there's a range of telemedicine presenters and champions that really are the linchpin in helping the specialist be able to help support the child and family in their home community. So the provider and presenter really working as a team to determine the scope of the presenter's assistance, and then the provider making sure they're considering any training needs of the presenter, especially if it's someone who may be newer to working with the population and behavioral health concerns. Thinking through the patient appropriateness for telebehavioral health services. So really thinking about what are the resources on the other side that are available to the patient, especially around any kind of safety concerns. This could be both around medical emergencies if you're helping a patient with a chronic illness who is also receiving behavioral health services, or it may be around behavioral health type crises, any kind of concerns around reports of suicidal ideation, and making sure that the distant site has all the resources should that emergency arise. Of course, in the home, thinking through how the patient or family could be supported if there is a crisis. Thinking through how the safety is also assessed. And then if we're thinking about care delivered outside of clinic, traditional clinic setting, such as a school, having the provider think through whether the school would be able to assist with sessions and ongoing engagement with the student and family, for example, over the summertime. Another area that really cuts across the professional guidelines is really thinking about working with diverse youth and families. We saw in that beginning slide, really the potential is for the provider to be able to reach anyone, any place, but really thinking about their own experience and competence in working across diverse populations. Of course, reaching out if there's additional training or supervision needs if they're working with a population that the provider is newer to serving. In working with youth and families, we of course pay a lot of attention to nonverbal and verbal communication clues. So making sure that with the technology we're utilizing, we're really able to attend to both and develop rapport with the patient and family. Thinking about the perception of telebehavioral health within the patient's cultural context. Of course, thinking about language and some of the language and interpretation needs that the patient and family may have. And then considering really the community and the different cultural things that may be influencing the family. And this includes both thinking about, you know, the rural environment and how different cultural impact may be influencing the patient and family, and really again partnering with the family and the presenter to understand that context. This next set of things with the guidelines and things to keep in mind really have to do with making sure we're gathering all the key pieces of information for telebehavioral health. So this really intersects some of the health information exchange, making sure we're thinking through how we can gather information and then what the needs of sharing information and how we can make sure we're following all best practices with that information. And this holds true both with the consult and as well as ongoing clinical findings and reports. This just really speaks to choosing the video conferencing platform. So there's a number of secure video conferencing platforms. Just again, our telehealth resource centers can really be an asset with thinking through what's the need and then what's the best secure technology as one way's meeting that need. Thinking through sufficient bandwidth for the telebehavioral health consultation, just making sure that the bandwidth is sufficient to be able to see, hear, and then pick up on cues as you're interacting with the patient and family. This speaks to the general assessment and psychological testing. So again, just thinking through what is able to translate over the televideo system, and if there's components of that assessment that don't translate, thinking through how will that be completed. Will there be on-site supports that complete that component? Will the patient be seen in person? For components that are more difficult to translate over the video conferencing, but just really thinking ahead about what the assessment needs will be and how to meet those needs. In terms of pharmacotherapy and intervention with youth, again, really checking with the professional organizations guidance, be it the American Academy of Child and Adolescent Psychiatry, the American Psychiatric Association, and other professional organizations have good guidance around telepsychiatry practice. This is just repeating that, really thinking through the communication and documentation needs across sites, in compliance with the regulatory guidelines. Encouraging telepsychiatrists to think and support guidelines and communication, including obtaining initial prescriptions, refills, and then the mechanisms for reporting and documenting any adverse effects. And then, as we talked about before with Ryan Haidt and other legislation, just utilizing resources from professional organizations, from the telehealth resource centers, to understand the most recent regulatory needs. In terms of thinking through psychological approaches, thinking about, again, all the best practices used in on-site and translating those to the telebehavioral health setting. Similarly, looking to professional organizations such as the American Psychological Association, the American Counseling Association, really across professional organizations, and looking at their guidance around behavioral health. And then thinking also about how the counselor may monitor outcomes consistent with the on-site setting. We talked a little bit about this earlier. This just reiterates some of the thinking through mental health emergencies with youth, and making sure all the T's have been crossed and that there's a plan should there be a mental health emergency while providing services. And then in addition to the legal regulatory, also thinking through ethical considerations. So thinking through the organizational values and how that fits up with the telebehavioral health services. Thinking about again, putting the patient front and center and thinking through their rights and responsibilities. And this may include, if it's not a fit, acknowledging that telebehavioral health isn't a fit and looking at other options. And then it goes back to good communication with our patients, and just as they have questions or concerns, making sure that we're supporting them in asking and addressing those concerns. And then finally, just making sure there's no conflicts of interest. This can sometimes come up because there's intersections between providers and some of their technology companies, those kinds of things. So again, it just really speaks to transparency. And then thinking through telebehavioral health competencies, seeking training and peer mentorship in implementing telebehavioral health, especially as you're starting off with telebehavioral health practices, really finding that mentor or someone that you can bounce ideas off of as you're moving forward with telebehavioral health services. This might also include things like shadowing, but really having that resource to help support as the provider moves forward. And then we've already talked about the clinical competencies. Of course, thinking through both clinical and the process components, building rapport, and those other important communication skills with your patient seen over telebehavioral health. I'll stop there in terms of some of the guidelines. Again, it's all doable things. It's just sometimes I know myself, I get so excited about the technology and the possibilities. It's just some reminders to take a breath and then think through each one of those components, really needing together as a team with our sites that we're partnering and our providers and our administrators to make sure all those T's are crossed to really set the telebehavioral health service up for success. So I want to go through some examples of just the different types of telebehavioral health services that that we see in Kansas. Again, there's many others that could be added to this list. The idea is to get folks thinking about some of the range of telebehavioral health settings and services. So if you're thinking about setting up a service, it might help think of, oh yeah, I could also think about group, or I could also think about a support group. It's really just to kind of give an idea of the range. So one of our projects is Telehealth Rocks. Again, we're fortunate to have HRSA funding for this project. And with Telehealth Rocks, it looks at developmental and behavioral health services in Southeast Kansas, really, again, focused on meeting some of the access need. We talk about the 2020 rule in child behavioral health. So about 20% of children and youth under 18 will meet the criteria for a behavioral health diagnosis, but only about 20% of them receive any type of treatment, and much fewer receive child-specific specialist treatment. And that, of course, can lead to delays to treatment, and speaks to the need for telebehavioral health. With this project, it uses the professional version of Zoom, and utilizes that over multiple devices. And then there was an extension with Telehealth Rocks, really focused on some of our primary care partners. Telehealth Rocks Schools extends that same idea with telebehavioral health and developmental services, but also with our schools. And we've been very fortunate to partner with the South Central Special Education Cooperative, as well as our Community Health Center of Southeast Kansas with some of their school-based health centers. So the idea is really catching students where they're at and being able to deliver behavioral health services right in the school, with the hope it's really in a trusted environment, a non-stigmatizing environment, and really supports the families with a point of entry into the behavioral health system. This is just a slide that speaks to, again, some of the need and some of the limited availability of behavioral health, especially child behavioral health specialists. With Telehealth Rocks, it is the delivery of services, and that's really across assessment and treatment. It also includes telementoring and educational components, and as well as work with engagement and family support, and workforce development, and really including our behavioral health trainees in the telebehavioral health services, with the goal of encouraging to think about outreach early on in their careers, as well as to get experience providing services. Again, this is a reminder slide of how important the presenter is in our school-based services, really helping before, during, and after the behavioral health interventions across the student and guardian needs, the education system, especially behavioral health and primary care. With Telehealth Rocks and really across all our projects, our goal is to translate the same quality services to the telebehavioral health environment, really thinking through the individualized needs of the child, including developmental considerations, parent or guardian preferences, resources at the patient site, and the behavioral health provider's comfort. We've really been successful in translating the range of developmental and behavioral health services, including family and behavioral therapy, medication management, parenting and prevention, some of the applied behavioral analysis approaches, assessment, especially assessment for autism, feeding and weight issues, including feeding difficulties, as well as pediatric obesity interventions. And then one of our most popular clinics has been our toileting clinic. And this was really driven by the school nurse and personnel concern. They were seeing kids being teased that were having toileting concerns, and that really impacting their well-being and as well as their function in the school setting. So the toileting clinic takes a real behavioral approach in helping students. And again, then with that success, we see the student being able to stay in the school setting and also really gain more confidence. We also have a number of projects that are working with home telebehavioral health. These are often more on the research side. Many of these projects mix the synchronous video conferencing that we've been talking about today with asynchronous content or things through the web, text, and apps. One exciting project is Dr. Carol Smith's project, looking at support groups over televideo for patients on home parental nutrition. Our Mom Health project is looking at supporting pregnant and parenting teens using home-based telehealth. This ranges from group interventions with the moms as well as individual coaching with them on key topics including breastfeeding, healthy lifestyle, and depression prevention. The I Am Healthy home-based project, it's looking at a family intervention, behavioral intervention to decrease pediatric obesity. The Red Chip intervention is another home-based intervention that looks at parenting groups to help support parents of newly diagnosed type 1 diabetes. And then the Telehospice project, which is really an exciting project with Sandy Coleman's team and Hospice Services, Inc., where it's really looking at how can the home-based telehealth help support some of the broad needs, but including behavioral and grief support and the range of needs of both the telehospice patient and caregiver. And it's just an amazing project in what the Hospice Service Inc. has utilized the technology really to connect families who may be states away and really to support the patient and family. There's also a number of healthy lifestyle interventions, telebehavioral health interventions. This ranges from kitchen therapy, led by our Midwest Cancer Alliance, which is utilizing the televideo technology to connect our industrial kitchen at the Midwest Cancer Alliance setting. And they hold monthly sessions around cooking healthy foods and linking that up with some of our distant sites. Other healthy lifestyle interventions that have been successful over telehealth include smoking cessation, adult obesity and healthy lifestyle with the Repower clinical trial with Dr. Beffert, and then looking at weight loss with chronic illness. We've talked a little bit about this already, but across all the services that we're mentioning, we're really encouraging thinking about training and supervision and including trainees throughout the telebehavioral health process. There's also opportunities with telesupervision and ongoing support with early professionals in the field. I know Carla Deckert did an excellent Tella Echo presentation earlier in this series. So this is just a reminder of the real power and value of Echo with behavioral health services. Again, with many of my projects, it's really trying to pair the two together to offer both the telementoring as well as the traditional telebehavioral health services. Just to give you an idea of the range of telebehavioral health type echoes that we've completed. These have been often child-focused, but there's many opportunities looking at adult telebehavioral health and echo as well. And then finally, again, I know we've covered a lot in this hour. It's hopefully to get you thinking about really, telebehavioral health is a can-do thing. There are a lot of T's to cross and things to think through, but it's really allowing us to look toward the next step and thinking about when we're serving patients and families, which technology is best, which place, which system is going to best meet that individual's needs and preferences for health and healthcare across the lifespan. And then even more broadly, how can telehealth be utilized as a piece of community resilience? So especially with our echo and telemetry and capacity building, how can the technologies help us connect together and how can it help us as a whole team address some of the high needs that we talked about earlier in the presentation. So I'd love to talk with you further if you have interest in telebehavioral health. I listed some resources that are also very helpful. I know Janine will talk some about our telehealth resource centers, and then again, I'd be excited to talk to you about your own telebehavioral health program if I can help in any way.
Thank you, Eve-Lynn. Sherry, do we have any questions from the audience? And if those of you who are attending, if you have a quick question that we could answer very quick. I know that there was a question of whether or not these slides will be shared. Eve-Lynn, can we share these slides with participants?
Yeah, I think that's a great idea, Janine.
Awesome. We'll make sure that those slides are getting to you at some point in the very near future. And monitoring, I don't see any questions, any other questions, but at this point, Eve-Lynn, if you will allow me to share my screen.
Okie doke.
All right. So if Sherry will monitor any questions that may come in, I'll go ahead and try to wrap things up here. Again, thank you all for participating. This presentation has been part of the HTRC webinar series. The next webinar is scheduled for March 5th, where we will discuss teledentistry projects. It may not just be in the state of Kansas. We may be able to include some other states because this is a fairly new way of utilizing telehealth in dentistry, and I think you'll find it quite interesting. In addition, the National Consortium of Telehealth Resource Centers also has a webinar series, and their next webinar is February 21st, and it's going to be talking about federal and state policy updates, some CMS changes. They'll get a little bit into state trends. They just won't be able to address everything that's going on in all of the states and territories that the TRC covers. But this will be a very interesting webinar by the Center for Connected Health Policy. So please go to telehealthresourcecenter.org to register. Again, we'll check for questions at this point.
Janine, I do have a question.
Okay.
Are there any programs or grants that will help fund resources for families to obtain internet or iPads/computers?
Well, that's a really good question. And as it pertains to telemental health, Eve-Lynn, do you have any answers for that?
You know, in terms of a lot of the projects I was describing are research projects. So sometimes with the research project, there is the provision of the equipment. When we're more looking at clinical practice, I'm not aware of any. I know some individual insurers are sometimes looking at the equipment, especially when they're looking at overall chronic disease management. So the behavioral health could be a component with that, but that's really variable across insurers, and many of those are still pilot projects. It's a great question.
It is a great question, and many times when I work with organizations throughout the region, I recommend that they may look into their community foundations, because many times you might be able to present a project to that community foundation and they would fund some of that type of equipment for you if you have a well thought out project. And if you need assistance with that, you certainly can contact me at Heartland TRC.
That's a great idea, Janine. I think you know, as you're thinking about that, we're always encouraged thinking about the equipment, but then how to support the personnel who will be managing and keeping track of the equipment on an ongoing basis.
Exactly. Any other questions, Sherry?
I am looking and I do not see any.
All right. Well, again, thank you for attending this webinar. And if you need more information, please feel free to contact me at the email address that you see on your screen, jgracie@kumc.edu, or Eve-Lynn's email, as she provided that through the presentation. This concludes our webinar, and we look forward to seeing you virtually next time. Thank you, and have a great day.